Hi friends, how are you? This is Dr. Ravi Kant Tiwari from the Department of Pharmacology, and today I am going to discuss with you a special topic, that is effect of drugs on dog blood pressure. Before I proceed to this topic, I want to discuss some things to the students that in India, as per the guidelines from MCI and NMC and UGC, the animal experiments have to be performed on simulation mode or computer assisted learning CAL on computers only, because the experiments are banned in India for undergraduate medical courses. So CPCSEA, that is Committee for the Purpose of Control and Supervision of Experiments on Animals, the institution performing this type of activity should have institutional ethics committee, animal ethics committee, and that IAEC should be registered with CPC. And in that case also, if for research purpose any institution want to perform this experiment, then the permission from CPC is required. So the basic motive behind this PPT is to make the understanding of the mechanism of action of drugs clear, so that students should be able to know the exact mechanism of action of drugs, that is the pharmacodynamics involved in the regulation of blood pressure. So I have chosen this topic. So to begin with, the learning objectives are to study the effect of various drugs on dog blood pressure. What drugs are included? The drugs are epinephrine, norepinephrine, isoprenaline, acetylcholine, and histamine. And to see the effect of blockers on the responses produced by these drugs, Dale's vasomotor reversal and re-reversal, tachyphylaxis, nicotinic or ganglionic action of acetylcholine, and the effect of carotid occlusion and vagus stimulation. So we will discuss each of these experiments one by one. So animal used in this experiment is dog or cat. Apparatus required are research chemograph or computer and data acquisition system, operation table, U-shaped mercury manometer, tuberculin syringe, burette, arterial, venous and tracheal cannula, connecting rubber tube, dissecting instruments, cotton and thread. Drugs required are epinephrine 2 microgram per kilogram body weight of the animal, norepinephrine 3 microgram per kilogram body weight, isoprenaline 3 microgram per kilogram body weight, acetylcholine 5 micrograms per kilogram body weight, atropine 1000 microgram, or you can say 1 milligram per kilogram body weight, phentolamine 1 milligram per kilogram body weight, propranolol 1 milligram per kilogram body weight, ephedrine 100 microgram per kilogram body weight, normal saline, that is 0.9% NaCl, and the required anesthetic agent is chlorellose, that is 80 to 100 milligram per kilogram body weight. So what is the procedure for this experiment? A healthy dog of mongrel or beagle variety is weighed and anesthetized with pentobarbital sodium or chlorellose. After the animal has been anesthetized, it is mounted on the operation table in supine position, and its limbs are tied to the corners of operation table. After that, the femoral vein is exposed in the thigh region and venous cannula is inserted in the vein. Venous cannula is connected to a burette with the help of rubber tubing, which contains normal saline, and this route through femoral vein is utilized for injecting drugs IV. Then a midline incision is given in the neck, skin fascia reflected, muscles are separated, and trachea is exposed. After exposing trachea, search for carotid artery lying in the deeper tissue on the side of trachea. An arterial cannula hyperinized is inserted in the carotid artery, and this cannula is connected to a mercury manometer with the help of pressure rubber tubing, and this set is used for recording the blood pressure on chemograph drum or computer. In modern days, computer is utilized for recording the blood pressure with the help of pressure transducer. A partial transverse cut is also given in the trachea, and Y-shaped tracheal cannula is inserted in the lumen of trachea and connected to the respiratory pump. So you have to remember that the drugs are given IV through femoral vein. We record the blood pressure of carotid artery or the contralateral femoral artery through the computer, and after administration of each drug sample, 2 ml of saline is injected, that is flushed each time. So this is the list of instruments required or equipments required. So procedure I have discussed very briefly. The ultimate aim of this PPT is to make the understanding of the drug action clear. So I have subdivided the objectives into experiment number 1, 2, 3, 4, 5. You can see that in the experiment number 1, we are giving first the agonist, that is the epinephrine, then the antagonist alpha blocker phentolamine, then we have again repeated the agonist epinephrine, then we have given the antagonist beta blocker, that is propranolol, and again given the agonist epinephrine. In the similar way, we have followed norepinephrine, followed by phentolamine, followed by norepinephrine, followed by propranolol, followed by norepinephrine. In the third experiment, we can use agonist isoprenaline followed by alpha blocker phentolamine, then isoprenaline followed by beta blocker propranolol, followed by agonist isoprenaline. In the experiment number 4, we can see that the drug ephedrine is repeated each time to show its effects. In the experiment number 5, you can see acetylcholine is given in the low dose, for example 5 to 10 microgram per kilogram body weight, followed by atropine in the dose range of 2000 microgram per kilogram body weight, followed by higher dose of acetylcholine, that is 150 to 200 microgram per kilogram body weight. So what effects on the mean blood pressure will be observed in these experiments? We will discuss one by one. So first, the effect of adrenaline. As we know that adrenaline is agonist at alpha and beta receptors, alpha 1, alpha 2, as well as beta 1 and beta 2 receptors, it has agonist action. But the one point to remember is that alpha action is seen at the higher doses, while beta action are seen at the lower doses. Means alpha receptors are the strong receptors or strong action receptors, while beta receptors are the sensitive receptors. So when we inject adrenaline rapidly in the animal, the systolic blood pressure as well as diastolic blood pressure will rise, means mean blood pressure will rise. But after some time, when adrenaline is metabolized by the enzymes, its concentration will fall in the plasma, and so its concentration becomes low, leading to action on the beta 2 receptors. So there will be a fall in mean blood pressure before coming to the normal. So it means that it produces a type of rise and small fall, that is a biphasic response is seen in the mean blood pressure when adrenaline is injected in the animal. Noradrenaline, as we know that noradrenaline has only alpha 1, alpha 2 and beta 1 agonist action without beta 2 action. So it will not show the biphasic response, it will show only the rise of mean blood pressure accompanied by reflex bradycardia, and there will be no biphasic response since the beta 2 action is absent. Isoprenaline, in this topic we have to remember the receptors involved in the action of these drugs, then only we can understand the proper mechanism of these drugs. So you have to remember the receptors involved of each drugs. So isoprenaline is having no alpha action, it has beta 1 and beta 2 action. So beta 1 action will cause tachycardia, while beta 2 action will produce decrease in diastolic and mean blood pressure. The next drug is ephedrine. Ephedrine is a mixed action sympathomimetic. It has action at both alpha beta receptors as well as it will increase the secretion of neurotransmitter norepinephrine. So it has a sustained and prolonged rise of blood pressure as compared to epinephrine and norepinephrine. Acetylcholine is cholinergic drug. It has M2 M3 action. By M2 action it decreases heart rate, while by M3 action it will cause vasodilatation. So it leads to a sharp fall in blood pressure, which returns to normal very quickly because acetylcholine is rapidly metabolized by cholinesterase enzyme. In Dale's vasomotor reversal phenomenon, prior administration of alpha blocker will cause only depressant effect in the mean blood pressure of epinephrine. So in this, epinephrine, when given after alpha blocker, will show only depressant action or in the mean blood pressure because of beta 2 action, and this is called Dale vasomotor reversal phenomenon. Atropine has no consistent effect on blood pressure, it only produces tachycardia. Propranolol is a beta blocker and phentolamine is alpha blocker. Both the drugs cause decrease in blood pressure. So you can see these effects in these graphs. In the first graph, first curve, you can see the effect of epinephrine followed by phentolamine, followed by epinephrine, followed by propranolol, that is beta blocker, followed by epinephrine. In the second, you can see effect of norepinephrine followed by phentolamine, followed by norepinephrine, followed by propranolol, followed by norepinephrine. In the third case, you can see the effect of isoprenaline followed by phentolamine, followed by propranolol, followed by isoprenaline. This is the effect of tachyphylaxis when the responses are decreasing because of rapid administration of the same drug. Carotid occlusion causes rise of blood pressure, while vagus stimulation will cause decrease in blood pressure. So this topic is very relevant for the experimental pharmacology topics, and